Hello, this presentation is about patients' motivations and expectations when seeking urgent care at emergency departments and their acceptability of primary care streaming. And it's a realist study and it looks at the context and mechanisms that influence motivations for attending the emergency departments, acceptability for being streamed to a primary care clinician, and also satisfaction with the experience. So we interviewed 23 patients across 13 case study sites. All patients had one of 5 low acuity complaints, and these complaints could be seen by either an ED clinician or a primary care clinician. So 12 patients were seen by an ED clinician and 11 streamed to primary care. So in terms of motivation for accessing an emergency department, we found that patients with long-term conditions or patients that had previously accessed the emergency department for the same problem develop knowledge of when to seek emergency care and where to seek it. And also we found that patients that have difficulty accessing appointments in local primary care or can't access appointment but not at a time that's convenient to themselves may seek convenient access at an emergency department. So in terms of acceptability of primary care streaming, so we found that patients seeking urgent care at an emergency department had no expectations of who they're seen by sometimes, and if they're seen within an acceptable time frame, and they trust the initial assessment process by a nurse, and they feel that they've had appropriate investigations and follow-up and assessment by a GP, then they will find primary care streaming acceptable. In terms of satisfaction, we found that patients who had difficulty accessing local primary care or expected to wait a long time in the emergency department, or patients where investigations are explained to them or why they're needed or not needed and how they help with their treatment, they may experience shorter waiting times to treat their complaint than expected. They may feel that their complaint has been dealt with appropriately and as they've had the appropriate investigations, they may be satisfied with their care. So actionable findings from our study are that service user feedback is useful to evaluate changes in services and provide insight into what mechanisms that primary care streaming is acceptable to patients. So we found that primary care service models can be implemented in emergency departments with an expectation that patients will find streaming acceptable. And we found that primary care service models can be implemented in emergency departments with an expectation that they will reduce waiting times and therefore increase satisfaction.